I've been with United Way almost 7 years, and one of the first things I recognized was the strength in partnership and in collaboration. And when I think about everything that we do here, not just on the public policy side, but holistically, there are few partners we look to and are inspired by more frequently than we are the Schuyler Center. And I am thrilled they asked to host this event in our space today, to bring somebody like the Commissioner here to host this town hall and talk through Governor Hochul's budget proposal. And that partnership is in no small part thanks to the leadership of our next speaker. And if you care about working families and you care about working New Yorkers, you then also most likely believe in the eventual sainthood of Kate Breslin, who's so humble. This is making her completely uncomfortable. But she is and always has been a champion for the working class, for the poor, and through her leadership, we are actually beginning to see real progress from New Yorkers. And you have our organization and my personal sincere admiration. So here to kick us off, President and CEO, Schuyler Center, Kate Breslin.
Thank you, Peter. You're so kind. My role here today is small and important. I'm so excited. As Peter said, you know, none of us can do this work alone. Kate Breslin, I'm the President and CEO of the Schuyler Center for Analysis and Advocacy, and a big thanks to the Office of Temporary Disability Assistance and the Commissioner and the whole team who enthusiastically embraced this opportunity to meet with providers and advocates in the region, and to the United Way of the Greater Capital Region and the Blake Annex, because this place is gorgeous. Sorry for those of you who are impeded by the snow. We love this place. We love our partnership with the United Way and Blake. And we really just, if we are going to do better by everyday New Yorkers, and particularly those who are disenfranchised or experiencing poverty, none of us can do this alone. We need partnerships out in the community. We need partnerships with our state government leaders and workers, and we need partnerships with people working in local government and local communities. So I'm just so grateful for the opportunity to kind of have this conversation together with you, and hopeful that those of you who are participating online are at least able to hear us. I want to just also mention, I serve on the Child Poverty Reduction Advisory Council, which is a state-level body trying to figure out and make recommendations about how New York can cut child poverty in half in the next 7 years or so. And Commissioner Guinn is one of the co-chairs of that body. And you know, as somebody who's served on a lot of different bodies, you know, that the state invites me to serve on, I have to say that Commissioner Guinn is always receptive, always open to a conversation, always open to questioning, which doesn't always happen, and always eager to sort of get to the best solution. So I feel really blessed that we have her and her team here today. So.
Thank you so much, Kate, and thank you, Peter, for hosting us here at Blake. Obviously, I've read a lot about this location in the news, but it is absolutely beautiful, so I'm so pleased to have an opportunity to come here and have a tour. It's a wonderful space. And also, thank you, Kate, for your remarks, but also importantly, your leadership in this space. I really appreciate the work that you and others do to help New Yorkers. Excuse my voice, it is about gone, but I'm going. I said I would be here, I'm here, and we're going to get through this. I'm very happy to be here. And make sure I know how to work this. should I be pointing elsewhere? So, I'll get started. I am the Commissioner of the State Office of Temporary Disability Assistance, and the work that we do is really focused on helping people get out of poverty, move into the middle class, and become financially secure. We oversee the administration of many public benefit programs, including public assistance, supplemental nutrition assistance program, HEAP, child support, and others. So I'm very honored to have the opportunity to lead this important agency. This year, Governor Hochul, her entire 25-26 agenda is laser focused on two areas. Affordability, which I'm sure you've heard her say, she is very focused on affordability, making sure that New Yorkers have access to resources that they need and they're able to advance economically. And also public safety, that is something that she hears consistently as she travels throughout the state of New York. So she is very much focused on economic security as well as public safety. Very much wants families to come to New York, stay in New York, and thrive in New York State. So since taking office, in terms of the governor's focus on supporting lower income families and individuals, she has really been able to advance a lot of important policy changes. But she's done this at the same time as investing in reserves so that we have substantial kind of rainy day funds and we remain fiscally stable. She has worked to raise the minimum wage in New York State, which, as you know, is essential for a lot of workers, not just teenagers, but also adults. And very importantly, and something that we're really proud of, as the minimum wage in New York State now also will be evaluated moving forward as required by legislation to make sure that it keeps up with inflation. That is very important. She also expanded New York's child tax credit to bring in children from 0 to 4 who were previously excluded from that credit. She's also fought to eliminate co-pays for insulin for people who rely on that life-saving drug and don't have to make choices between their medicine and other bills. Again, our State of the State agenda for this year does include, as Peter referenced, a lot of good news for families and lower income individuals in New York State. Definitely a strong focus on children and families, and that's what we will focus on. Thank you so much. I feel a little bit better than I said. So again, a very, very strong focus on children and families. She's been able, a couple of items we will focus on today, we'll kind of go through. Obviously, tax relief is one of the areas that she is focused on. She's reducing middle class taxes by up to 5%, which will benefit 421,000 capital region taxpayers making less than $323,000 a year. Her proposal includes sending what she refers to as inflation refund checks, getting money back into the pocket of New Yorkers throughout the state, and that will include up to a $500 payment for tax filers. And she also continues, which is important in particular to homeowners, to fight at the federal level to eliminate the cap on deductions for state and local income taxes. That's very important in New York, in particular in areas of our state that have particularly high housing costs that lead to higher property taxes. So, in terms of investments in families, one of the things that we are most excited about with the governor's budget proposal is an historic increase in the child tax credit. This is the most significant increase in this credit since it was created. She is seeking to raise the credit from what is currently a maximum of $330 per child to increase that to the maximum of $1,000 per child for children 0 to 4. And then next year would also increase it to $500 for older children who are eligible for this credit. The credit is going to benefit about 145,000 children within the capital region. This is actually, Kate was referring to the Child Poverty Reduction Advisory Council, which I do have the honor to co-chair. The enhancements to the child tax credit, definitely one of the top, if not the top proposal by that council, because it is evidence-based. We know that it works. We know that it will provide money directly to families who can use that money as they deem appropriate to meet whatever the needs are that they have. And it also has been evaluated and proven to reduce child poverty. So the investments made as proposed by the governor will reduce child poverty by about 8% in New York State and about 10% for younger children. So we very much look forward to working with the legislature to enact this really important increase in the child tax credit. So I'm going to go through a couple of the good news investments for children and families in addition to the child tax credit. In terms of the governor's focus on young children in New York State, this budget, again, it builds on some work in previous years, including the coverage, the 0 to 4, the child tax credit, the expansion of continuation of Medicaid coverage for children, and also something that I think is really important for parents or expectant parents in New York State that just went into effect this year, January 1, is paid parental, paid prenatal leave of 20 hours so that mothers during their pregnancy can make their medical appointments, again, without having to choose between a paycheck check and being healthy, keeping themselves healthy, and having their babies healthy. So that is a huge change and a shift, and we're proud that New York's a leader in that area. Also, in terms of young children in this year's budget, our agency, as proposed, will administer what's referred to as a birth allowance for beginning year. And what this will do is provide for individuals who are in receipt of public assistance in New York State. So some of the lowest income needy households in the state of New York. We will provide a $100 a month additional allowance during pregnancy, and then also add to that a one-time payment upon birth of the child of $1,200. Again, the intention being to help that the new parents to meet increased costs associated with both during pregnancy to stay healthy and post-pregnancy to have be able to meet the needs of their children. We also will take on an initiative working with Baby to Baby to provide two things for families in New York State. One is referred to as kind of a baby box. And the goal is to expand on some work that Baby to Baby has been doing in New York City and elsewhere to provide postpartum boxes, or actually bags, for parents following the birth of their child. So includes both postpartum supplies, important supplies for infants, and then also a good amount of information on access to resources, including potential, the need for services through the mental health system for parents, and having a new child is a lot. It's very overwhelming, and we want to make sure people know where they can go for access to supports if needed. So the goal here is to provide these boxes. Maybe we distribute directly to hospitals. We work with the Department of Health to identify hospitals that tend to serve high-need patients, and then deliver the boxes that way. And then we'll also partner with Baby to Baby to expand the availability of free diapers throughout New York State. So the goal there is a distribution of additional 10 million diapers per year as this is enacted or moves forward. Another huge movement for New York State, finally, the governor's proposal includes the next investment needed for us to have universal free school breakfast and lunch throughout New York State. So this proposal includes $340 million in state support in order to make this happen. The new investment will allow any school that is participating in the federal free and reduced price school program to have universal school meals, so cover any cost that they may have otherwise needed to incur to make it universal. So you all know why this is so important, right? I mean, it'll reduce stigma, so children don't feel uncomfortable accessing food. It'll help reduce hunger, so that children who are attending school show up ready to learn. It has been proven to improve attendance as well. So not only will it reduce hunger, we expect that it will also improve educational outcomes, which everyone knows the better people do with early education, the better their prospects are moving forward as an adult with respect to their employment opportunities. So again, applaud the governor and look forward to working with the legislature to enact this. Another investment in the budget is to actually, I think for the first time, provide state funding to support the WIC program. So women, infants, and children, again, a nutritional benefit for pregnant women. The goal here is to, of course, to continue to access federal WIC benefits, but also to make sure that New York can expand its enrollment in this program. So the goal is, through these state investments, to increase WIC participation from what is currently about 445,000 enrollees throughout New York State to increase that by about 30,000 to a total of 475. So we're really excited about that. Our agency will also be partnering with the State Department of Health to improve our data sharing so that we are better catching those who may be eligible for SNAP or receiving SNAP, but also eligible for WIC, to make sure that they are aware of WIC and encouraging them to apply, and vice versa. It's surprising. You would think that if you know about WIC, you would know about SNAP, and vice versa, and that you would be applying for both, but data shows that that is not the case. We are working toward a technical solution to this, but that's years off, and so we've been working with the Department of Health on a data share agreement so that we can improve outreach to make sure that those cross-program enrollments occur. And then childcare. Everyone knows childcare is a major cost for families. Very expensive, often more than a mortgage. So families, when they need childcare and going to work, which we want people to go to work, it's very difficult because the cost of childcare is a significant cost for families. So in addition to historic investments of $7 billion in childcare that the governor has made available throughout New York State, we know that childcare can still be a barrier even for those who are eligible for the subsidies because there simply aren't enough childcare providers in New York State. So, governor's budget proposes $110 million investment in a childcare construction fund. So what this would do would be funds available to support capital development and repairs necessary to open childcare centers, keep childcare centers open, and it will be available to both formal care childcare centers as well as family-based childcare. This will be administered by the Office of Children and Family Services, and they do expect to issue a procurement in order for individuals and centers to apply for these funds. Housing. Like childcare, the cost of housing is a significant part of individuals and families' budgets. As everyone knows, as the vacancy rates in New York State have gone down, the cost of housing has gone up. Rents certainly increased significantly following the pandemic. And so there are additional investments in housing this year. So the governor has her larger housing plan, which focuses on build, build, build. And our agency's role with this is really in the area of supportive housing. So supportive housing is housing that is both affordable, but also comes with services that individuals need to remain stably housed. It focuses on accepting individuals who were formerly homeless or in high risk of homelessness. And again, those services are critical for those individuals to remain housed. We have some good news in our budget this year, which we're really excited about, and again, look forward to working with the legislature to get these enhancements enacted. We operate the Homeless Housing Assistance Program, which is money for capital development, so to build affordable, supportive housing. This year, the HHP program is funded at $153 million. That's a $25 million increase from last year's enacted budget, and it is intended to be targeted toward preserving older housing stock within the HHP portfolio. In terms of speaking toward older housing stock, we also administer the New York State's supportive housing program, and that program provides money to supportive housing providers to deliver services. It's intended to cover the services costs that are necessary to keep individuals housed. NYSHIP is its acronym. NYSHIP has rates per family or per individual that are quite low, and there has been a lot of advocacy around this for very good reason to increase these rates so that we don't lose this really critical supply of supportive housing. So we are absolutely thrilled that Governor Hochul's budget includes an additional $17 million for NYSHIP, which represents about a 40% increase, the first significant investment in that program, I think ever, as far as I know. So we're really happy. It's really critical that we keep the older housing stock online, or all of our efforts to build new are not going to result in increases, which is what we need throughout the state. And then finally, with respect to supportive housing, there's also significant increases in a different funding stream, which is referred to as the Empire State Supportive Housing Program. What this program does, and people refer to it as ESHI, this program also provides funding per capita to organizations that are operating supportive housing, and it's intended to cover both services as well as operating costs. So to the extent that rents need to be supplemented, it also supplements the rents. ESHI has been around, I believe we're in our 9th year of ESHI, and it has been at the $25,000 per unit. It did include 2% escalators each year, but it hasn't had a significant adjustment, which is again really needed given the cost associated with housing, and also to make sure that they can secure the workforce to deliver the services that are needed. So we're really happy with the investments in the governor's budget for ESHI. That $25,000 per unit investment will increase to $31,000 per unit outside of New York City and to $34,000 in New York City. So again, it should provide additional investments that will hopefully bring in additional providers to increase the supply of supportive housing throughout our state. And then lastly, with respect to some of these initiatives for children and families, the governor's budget also includes a proposal intended to boost the state's workforce so that we can have a strong economy, support our businesses. This proposal will provide for free college tuition as well as other costs associated with attending college, such as fees and books, for students ages 25 to 55 who pursue certain degrees in in-demand occupations. So for example, we target degrees in areas such as nursing, teaching, technology fields, and engineering. So hopefully, if this is enacted by the legislature, I think the next step would be for the community colleges to be reviewing their portfolios, or hopefully they're doing that already, to make sure that it's very clear which degrees are eligible for this free community college experience. So, wonderful opportunity. And then with respect to making New York safer, there are a lot of changes that have been moving forward with and that are advancing among the public safety field. I would just want to address things that are more within our portfolio. Our agency oversees two different really critical employment programs for youth. One is the Summer Youth Employment Program, which is funded in this year's budget at $51.5 million. And every county in the state receives funding to support that program. And then the second program is the Youth Employment Program, which is intended to support year-round youth employment opportunities in areas that are high crime, high gun violence areas. So these funds are available in the Capital District in Rensselaer, Albany, and Schenectady counties. These investments are important for public safety because they are evidence-based, have been proven not only to bring in additional income to lower-income households, but also have been proven, based on prior studies, to also reduce crime. So we're really pleased for these investments in youth throughout our state. So that really is what I have in terms of wanting to inform you about some of the important investments in families and children and low-income New Yorkers that are included in Governor Hochul's budget. Again, we'd like to thank Kate and other members of the Child Poverty Reduction Advisory Council for their efforts that have been supportive in helping to amplify the needs in these areas. And we very much look forward to working with the legislature and all of you to thank the governor and hopefully get all of these initiatives enacted. And I'm happy to take any questions you may have.
Come on, people. And if Commissioner restate the question, just
Absolutely. Yep.
What will the universal school meals look like? What kind of foods will they get?
What will the universal school meals look like, and
Like what kind of food will be served?
so the food that will be served is consistent with what is currently available through the federal free and reduced price meals program. So there are any school that participates in that program will now be able to offer free meals not only to those who meet the federal income eligibility standards for free and reduced price school meals, but to make it universal so that any child in that school has access to free breakfast and free lunch. So the state funds are funding what would otherwise be a cost to the local school district to participate.
I have two questions here in the chat. So Lauren asks, how will the governor work to change the laws in New York State to allow baby boxes to places other than just in hospitals? We have been interested in this for a couple of years.
So that's a good question, and we would be thrilled to work with folks who have ideas on distribution. The starting with the hospitals is because it is a distribution method that we feel confident we can pull off. And we also, hospitals know who is, when children are covered by Medicaid, so they can easily identify that it's a household in need. But anyone who has ideas about additional distribution options, we're open to. Certainly it's something that we would like to go beyond hospitals, and that is part of the plan. It's just figuring out the distribution method, I think, is the challenge. And so certainly feel free to contact me if folks have any ideas. as we move forward to roll out beyond
And is
hospitals.
eligibility for the baby box tied to Medicaid eligibility or tied to TANF?
So it is, right now, the plan is, it would be Medicaid, because that's what hospitals know, they have that information, but it doesn't need to end there. So the idea is that we would be able to reach individuals in poverty, otherwise very low income, again, starting with the hospitals and the Medicaid standard, because that's something that is readily available and doesn't require any forms or paperwork. The hospitals just provide them with the families. Yes.
What opportunities do you see in the budget or in conversations to address benefits splits? So as folks' income slightly increases, then they are ineligible for
Okay, so the question is what is available in the budget or otherwise to address what's referred to as the benefits cliff, which is a real or perceived notion that people who are just a little bit more than lose all of their benefits. So the budget specifically includes funding for one demonstration program in Monroe County to specifically study this issue and to work with individuals both on financial counseling and then also with supplements if needed to offset the loss of benefits for a period of time, so that if that is something that someone is fearful of losing benefits in order to take on more hours or promotion, we want to see how this can be supported and who will take that promotion or additional hours. So that's one item in the budget. It's also something that our office has been collecting data and studying, and so it's something that we will also be kind of completing that analysis and looking at where are there policy proposals that should be advanced that would eliminate any cliff. And we've actually made a lot of progress in the world of public assistance over the past couple of years. Governor Hochul's first budget, we were able to remove what we viewed as artificial caps that cut people off of benefits because their income hit poverty. So that has been eliminated, and it's more of a gradual reduction with about a 60–62% earnings disregard. We would love to see an increased disregard for the Federal Supplemental Nutrition Assistance or SNAP program, which right now only has a 20% work disregard. So that's something that our agency has been advocating for, that the governor has advocated for in terms of as things move forward with the federal farm bill changes in SNAP.
I have two questions. The first is the state is committed to cutting child poverty in half by 2031. Do you think we're on track for that?
So our first question is the state, through the Child Poverty Reduction Act and Council, is looking at how you can reduce child poverty in New York State by 50%, and are we on track? So we, as part of the council's work, we are working closely with an organization called the Urban Institute, which is an organization that is very well equipped to study policy changes and the extent to which those policy changes impact families in poverty. And to date, based on policy changes that have been made over the past couple of years, the Institute is projecting that we've achieved about 17% reduction, and then the child tax credit change will be another 8%. So I think we are making good progress. I think it is important for all of us to know that it's absolutely critical, though, those estimates assume full take-up. So it's really important as policy changes are made, including the enhancement of the child tax credit, that we all collectively do everything we can to make sure that people are aware of the benefits, that they apply for those benefits, and that we make it as easy as possible for them to access those benefits. And your second question?
The second question is, Edros New York runs the Raising New York Coalition, which released a report last year around barriers to accessing benefits. And one of the things that parents and families reported to us was that they needed more warm bodies to talk to. They needed someone who spoke the same language. It was difficult for them to, they gave up on accessing benefits because there weren't real people to talk to. There's a proposal in the executive budget around kiosks. Can you say more about that idea?
Yeah, so the question, I guess first made a comment about the individuals that the organization is hearing from often comment that it's difficult to access benefits, either through documentation requirements or language barriers, and sometimes people give up. And then referenced a budget proposal around kiosk for public benefit access that's included in the governor's budget. So I guess with respect to barriers, we are working hard to try to reduce barriers through technology improvements. We also fund many organizations who do the boots on the ground outreach efforts. Definitely, I think we could, lots of communities could benefit from additional ambassadors in terms of speaking the native language within the community. But that is part of our focus with a lot of our outreach efforts, is to try to make that happen, to fund those community-based organizations. With respect to the kiosk, there's money in the governor's budget to support kiosks that, this would be administered by the Office of Children and Family Services, and the expectation is that the kiosk would just be, they would be at new locations, so not in a social services office, but in other places where people know that's what this is, and they can go there and apply multiple different public benefits at that space. Thank you. Yes.
Hi, Commissioner Guinn. So in your presentation, you mentioned some coordination with SNAP and WIC. And you mentioned that the Office of Temporary Disability Assistance and the Department of Health will be working together kind of in the meantime as we look forward future years, right, for a technological solution. Are there opportunities for community-based organizations that do SNAP outreach and do WIC outreach to work with the state to, assist with the, kind of in the meantime?
Yeah, I mean, obviously, we would all greatly benefit, and I'm glad you raised that question. I think we'll take it back in the sense of making sure the data sharing permits that. I mean, there are lots of rules around, we want to protect people's confidentiality, but definitely, like I say, the boots on the ground outreach organizations often are the best point of access for individuals, so anything we can do to support that, we certainly would like to be able to do. So thank you for making that good point. Appreciate it. Yes.
Hi, Commissioner. Just want to first of all thank you, your agency, and the governor for proposing some really important investments in the executive budget. On the question of SNAP, I just want to ask. So there's a legislative proposal that would guarantee that every New Yorker participating in SNAP receives at least $100 per month. There's about 100,000 New Yorkers that receive less than that, 100,000, who's typically low-income older adults, often with a disability. Does the agency or the governor have a position on that legislation?
So the question was around the Supplemental Nutrition Assistance Program, or SNAP, and legislation that I believe is out there that would increase the minimum SNAP benefit from $23 to $100 with state-funded benefits. And does the governor's budget address that proposal? The governor's budget does not address that proposal, and as an agency, the reason people are receiving that minimum benefit as opposed to a different person may receive a higher benefit is because that household has additional resources that are higher than the other households. So our view is, sure, we'd love to increase everyone's SNAP benefits, but I'm not sure that targeting that group is necessarily what we see as the top priority, because those households, even though admittedly, yes, they are low-income households, and they would not be getting even the $23 benefit, but they are not the most needy households in terms of financial resources.
I have a few questions here in the chat. Lauren with Open Door Mission asks, when will HHAP be funded again? Is this part of the governor's budget?
Yes. So HHAP, the Homeless Housing and Assistance Program, it operates through an open procurement that is currently closed because we received sufficient applications to award all the funds that have been available from prior years. That procurement will reopen presumably right after the executive budget, or excuse me, after the state budget is enacted. And the budget this year does, Governor Hochul's budget increases funding for HHAP from 128 million to 153 million.
I have DiNapoli's report identified Saratoga and Glens Falls as having a large increase in homeless rates. What is the governor's plan to address this?
So we are definitely experiencing an increase in homelessness in New York State. Most of it is driven based on what's happening in New York City and individuals who have been able to seek shelter in the New York City shelter system, which we fully support. But we also definitely are experiencing pockets of increased homelessness in other areas of the state, including more rural areas that don't always see this. So the governor's budget, in terms of addressing homelessness, in addition to just some of the direct payments to individuals that we've talked about in terms of helping individuals and families, it also continues to fund not only ongoing public assistance, but we also have money for a rent supplement program, which is available to all counties in the state, where supplements can be given to households to get them into housing or to prevent eviction, where people contribute 30% of their income. We also have significant investments in homeless prevention activities, including outreach and trying to connect people who are homeless to resources. And then also, I would say, both last year and going forward, there's an important initiative that is really spearheaded by the Office of Mental Health to address street homelessness. And that effort is bringing together clinical teams to support outreach to individuals who may be residing on the street in order to engage them in services. So there's a lot of activity and funding associated with addressing homelessness throughout the state. We definitely would like to see those numbers go down. We know that it is not only associated with the migrant issue in New York City, but also just the cost of housing throughout New York State.
That's all I have in the chat.
All right, well, thank you all so much for making it out today. I really appreciate it.
Thank you.
I appreciate having you all here. Thank you.